will be having first the gram-positive catalase positive cocci. So nakita natin dyan, if we have the gram-positive, then it is a cocci wherein saan natin makikita yung gram-positive cocci, di ba, sa ating gram staining, wherein we said that the this is based on the phenotypic characteristic of the organism. Okay, so that in your gram staining, then you'll be able to see, di pa po ma'am. Tam, okay na ang audio? Okay, mag-start na tayo ng lecture. Tam?
Yes, ma'am. Okay po.
Okay. So, pag, di ba sabi natin, methods of studying your microorganisms or bacteria depends on two types. Di ba sabi natin, pwedeng phenotypic, pwedeng genotypic characteristics. Wherein, if we're talking of the phenotypic characteristics now, after na nakagawa kayo ng bacterial smear ninyo from a specimen, trying to identify what microorganism could be present there that is causing the infection, then the first thing that you would always do would be to do your gram stain. From the gram stain, then you can proceed with your algorithm. Like for example, sa gram stain mo, nagkaroon ka ng gram positive, na purple or blue yung kulay, and then nakita nyo na siya ay cocci, so that you're going to entertain now either you have a streptococcus or you have your staphylococcus. Paano natin ma-differentiate one from the other? Is that you're going to do your catalase test. Okay? Alam na natin kung ano ang catalase test. So that if you have a catalase positive, then that would be your staphylococcus, and then a catalase negative would be your streptococcus. Going further down, so that if it is already catalase positive, you get your staphylococcus and you would like to identify one from the other. Wherein, ang gagawin mo na ngayong test would be your coagulase test. Differentiating now staphylococcus aureus from the other staphylococcus, medically important staphylococcus. So that to differentiate now your coagulase positive from your coagulase negative, then you have to do again your nova biopsy to try to see which one now is saprophyticus and which one is epidermidis, basing on its nova biopsy sensitivity. So you will see here that there are three only of the Staphylococcus species that are on our algorithm o sa ating flow chart. So parang pag ang pinag-uusapan natin is Staphylococcus, then of medical importance, which is Bayer aureus, Staphylococcus, saprophyticus, and epidermidis. Although marami tayong members sa Staphylococcus. So, since we're talking of now the catalase positive, sabi natin kanina, the gram-positive cocci, I'm acknowledging Professor Raymel B. Magcora for this PowerPoint presentation. So, we can see here now our genera and species. Sabi nga natin kanina, we have our Staphylococcus aureus, which is coagulase positive, and then we have our coagulase negative staphylococci, wherein you have your Staphylococcus epidermidis, hemolyticus, saprophyticus, lugnosensic, and Schleicheri. Sa mga coagulase negative staph pa natin din is, of course, we have more of them. Ang dami din nakasulat. But as I have mentioned earlier, the Staphylococcus that will be learning in this session would just be those that are of medical importance. So, the general characteristics of Staphylococcus. So, alam nyo na they are catalase-producing gram-positive cocci, and they belong to the family Staphylococcaceae. Kasi meron tayo ng Micrococcaceae din na ibang family. Your Staphylococcus, they're aerobic or facultative anaerobe, except for Staphylococcus aureus, subspecies anaerobius, and Staphylococcus saccharolyticus, which are obligate anaerobes. Of course, we know they are non-motile, they are non-spore-forming, and Staphylococcus are spherical cells, kaya nga sila tinatawag na Staphylococcus, with a size ranging from 0.5 to 1.5 millimicron that appear singly, pwedeng in pairs, but most of them are in clusters. They're considered to be normal inhabitants of the skin, yung tinatawag natin normal flora or our microbiota, all the mucous membrane, and also on the intestines. On blood agar plates, colonies will, the characteristics of your colonies will be they're medium size and appear cream colored, white or rarely light gold and buttery looking. Now, other species may have gray colonies, some may be beta hemolytic. Okay, so not all, there are some strains of our Staphylococcus that could be beta hemolytic. Now, we need to differentiate our Staphylococci from micrococci. And what are the different tests that can differentiate one from the other? So we have here again, most of them are sensitivity tests. You can look at the table now. You have your bacitracin test. You have furazolidine, which is a sensitivity test. You have nitrosamide oxidase test, growth Pearson 180 oil red oil, and also the aid production role, and of course their off reaction. So you can see already the difference of Staphylococcus from micrococci based on this test. Okay. We proceed now to the first Staphylococcus, which is of medical importance, our Staphylococcus aureus. Okay. Staphylococcus aureus, nasabi natin Staphylococcus cocci in cluster. Kasi pag nakita nyo yan sa ano na on your gram stain and then you see a gram-positive cocci in cluster, then you'll be thinking already it could be Staphylococcus aureus. So they're true coagulase positive and most virulent, and they're considered to be the most virulent species of Staphylococci. So they grow well on most routine media like our nutrient agar and your TSB. On solid media, they appear round, smooth, opaque, and butyrous. Now again, on blood agar plates, colonies have golden yellow color and beta hemolytic. Now, they are halophilic or halophilic. Why? Because we said that they can tolerate 7.5 to 10% sodium chloride, 10%, 7.5 to 10% sodium chloride containing media like our mannitol salt agar. And Staphylococcus aureus, they are responsible for various skin, wound, and deep tissue infections. So we get into the virulence factors of our Staphylococcus aureus. So first for the antigenic structure. When we're talking of the antigenic structure, di ba alam natin saan ang mga antigenic structures ng ating gram-positive cocci or our Staphylococcus is on, ang mga ito ay nasa kanyang cell wall. So that on its cell wall, you see the schematic diagram of Staphylococcus aureus. We see here the different antigenic structures, like for example, your teichoic acid, which is, teichoic acid, you can see the arrow, which is the major antigenic determinant of the cell wall of Staphylococcus aureus. So, sa ating teichoic acid it is a polymer of ribitol, teichoic, a polymer of ribitol phosphate, and antibodies to teichoic acid now develop, especially in cases of endocarditis. Now, you see also here in the schematic diagram of the cell wall, another virulence factor, which is, of course, that is made up of the peptidoglycan, which together with the teichoic acid, it protects the bacteria from lysis and probably aids also in adherence. Another one on the cell wall is the protein A. What is the protein A? So we say that it is one of the several cellular components that have been identified also in the cell wall of Staphylococcus aureus. And what is the most significant role of this protein A? Is in infections caused by Staphylococcus aureus, is its ability to bind to the FC portion of the IgG. Ma-remember nyo yung immunoglobulin na parang Y shape. So that when it binds to the IgG, it can block phagocytosis and then it will negate the protective effect of that IgG. So, di ba nagtitwist siya para hindi makita yung surface antigens para hindi ngayon ma-determine ng ating mga phagocytic cells. So, it evades now phagocytosis. So, another antigenic structure there is you see the clamping factor. Ano si clamping factor again? Ano yung sa ating clamping factor? That it's a component of the cell wall responsible for clamping of the whole staphylococci in the presence of plasma. So that yan again, i-cover na naman siya. Doon sa likod ng clamping na yun, makukover na naman si Staphylococcus aureus. Then also it has the capsular polysaccharide, which also functions to protect the microorganism again from phagocytosis. So those are the antigenic structures of Staphylococcus aureus, which are illustrated all into this schematic diagram of its cell wall. Now, next is we also have the enzyme. Di ba sabi natin, ano na ulit ang role ng enzymes? What do enzymes do? When we're talking of enzymes, ano ang role ni coagulase, ni hyaluronidase, ni staphylokinase, and all of those are enzymes. So when we were talking of enzymes, anong ginagawa ng enzymes? Hello? Where is everyone? Ano
Ma'am,
ang
it
role?
catalyzes the reaction po.
Okay, thank you. So that if you have, like for example, your staphylocoagulase, what does it do? What does it do? You have it there already so that it coagulates fibrinogen in the plasma. So that we said that there are two types of coagulase. You already know about this one. You have the cell-bound coagulase or the clamping factor, and you have the unbound or the free coagulase. Okay? So that again, yan, pag nag-coagulate siya, di ba yung sa coagulation, matatakpan na naman yan mamaya si microorganism. Then you have also your hyaluronidase. Anong function ni hyaluronidase at bakit siya tinawag na spreading factor? And we're talking of the enzyme hyaluronidase, which is being produced again by Staphylococcus aureus, and it being considered a virulence factor of Staphylococcus aureus. So what does your enzyme hyaluronidase do? What does it do? It hydrolyzes the hyaluronic acid present in the intracellular ground substance, permitting the spread of infection. So, ano yung hyaluronic acid? Yan yung parang paste, para siyang if you imagine the different cells na magkakatabi, so in between those cells, parang may cement na nagkoconnect sa kanya. So that ground substance na yan, intracellular ground substance, ano ang ginagawa ni hyaluronidase? So it just hydrolyzes so that it somehow sisirain niya yun, degrades that intracellular ground, allowing now the microorganism to penetrate or to now sa invasiveness niya, allowing now also dissemination of the infection. So that is what the enzyme hyaluronidase does. Now, you also have your staphylokinase. Ano ang action naman ni staphylokinase? So, if you look at this one, you would ask, merong fibrinolytic activities by dissolving fibrin clot. Kung iisipin mo, si Staphylococcus aureus, meron na siyang staphylocoagulase, which aids in clot formation. Di ba? Ang clot formation, kailan nagkakaroon ng clot formation? Kailan magkakaroon ng clot formation?
Ma'am, kapag nakapag-interact po sa fibrinogen.
No, aside from sa hematology, when are your platelets activated to form a clot or a solid clot just to stop the bleeding? Wag muna tayo sa Staphylococcus. Hindi. Kailan nagkakaroon ng bleeding? Kailan lalabas yung mga ano doon? Pag nagkaroon ng damage, di ba? For example, when there is a damage to the vein or the artery nag-break, so that now activates the platelets to try to form clot para ma-block nila and to stop bleeding. That is the normal or the normal tawag natin, yung talagang dapat na magkaroon ng clot formation. But then clot formation can also be done by these microorganisms as their virulence factor. So walang na-break na vein pero merong clot formation that is being done by the staphylocoagulase of Staph aureus. So isipin nyo, nagka-clot siya tapos meron din siyang staphylokinase which naman acts in dissolving now your fibrin clot. Diba sabi natin kanina, ano yung role ni coagulase, diba? I-quote niya let's talk of Staphylococcus aureus. I-quote niya si Staphylococcus aureus, diba? Para hindi siya makita at hindi siya mapagositize. So that pag medyo pangit na yung environment niya, doon nakatago lang siya sa clot and then kulang na ang nutrients, then maa-activate si staphylokinase. Anong gagawin ni staphylokinase ngayon? I-dissolve naman niya yung fibrin clot na na-form earlier by staphylocoagulase para makalabas na siya doon. Kasi parang kulang na or the environment is not anymore supporting its growth. Aside from it protecting it, sana parang wala na siyang nutrients, wala nang nutrients. So that it needs to get out of that clot. Ngayon, magre-release naman siya ng kanyang staphylokinase para ma-dissolve naman yung clot. Okay? So, pag-isipin nyo kasi meron siyang staphylocoagulase na nagpo-form ng clot. Meron din siyang staphylokinase na nagdi-dissolve naman ng clot. So, parang contradicting, di ba? So, it works two ways for the benefit still of the organism. Now, another enzyme would be your lipase. So, alam naman natin si lipase, these are your fat-splitting enzymes and they are produced by both your coagulase positive and coagulase negative Staphylococcus. They act on lipids present on the surface of the skin, particularly fats and oil, secreted by the sebaceous gland, and these are important in the formation of furuncles, carbuncles, and the boils, which are these skin infection being caused by Staphylococcus aureus. Now, we also have again our dinase and phosphatase. Ano ang role ni dinase ngayon? Diba ni ating dinase and phosphatase? So that it says here it lowers the viscosity of exudate, giving the pathogen more mobility. Why? Because now, your dinase now that degrades the DNA released by dying cells. For example, yung mga cells ng yung bacterial cells or also host cells that can trap the bacteria, thus again promoting spread. So that dinase now degrade the extracellular DNA as a means of escape and spreading through tissue. Okay, so ang gagawin ni dinase na muna naman, there's again, sabi nga natin kanina, nagawa ng mga enzyme, is it will destroy the DNA. Then you have again your protease, and you know already the function of your proteases, your gelatinase, and your beta-lactamase. Anong ginagawa ni beta-lactamase? Di ba sabi natin, it breaks down penicillin and beta-lactam drugs. Okay, so hindi lang siya sa antigenic structure niya, hindi lang siya sa kanyang enzymes na naproproduce, meron din siyang toxins na naproproduce. So that when we're talking of toxins now, these are now your classified siya into your cytolytic toxins wherein you have your hemolysins and leukocidins. We have here 4 types of hemolysins. Ano-ano yung hemolysins na yun? So we have our alpha hemolysin, you have your beta hemolysin or your sphingomyelinase C, and then we have our, ano na itong sign na ito? Nakalimutan ko itong sign na ito. Then you have your gamma hemolysin. Ano itong C?
Ay, joke lang. Delta ata, ma'am?
Delta po, ma'am.
Delta, ma'am.
Delta. Okay, delta hemolysin. Hindi ko maalala yung kanyang symbol. Okay, so yan yung mga types of hemolysin. ng ating Staphylococcus aureus so that you know that your alpha hemolysin will damage the RBC. When it's hemolysin kasi, di ba, this is more of the, sabi kasi dati ng mga ibang books, when we're talking of the hemolysin as a toxin, these are more those that causes the hemolysis on the RBC. Although it has been seen in studies na hindi lang naman hemolysis, hindi lang RBC ang pwede niyang i-damage. Pwede rin niyang i-damage si WBC, which could be which is actually the function of your leukocidins. Okay? So, lagi sinasabi kasi hemolysin destroys the RBC and the WBC. Dati kasi laging pag hemolysin, it just damages only the RBC. But if you get into some books, makikita nyo din doon na ang hemolysins, they can also damage the WBC. So, we have here your alpha hemolysin. Ano sabi natin kay alpha hemolysin? It damages the RBC, platelet, and macrophages and cause severe tissue damage. This is the predominant hemolysin for Staphylococcus aureus. Then we have our beta hemolysin, which acts on the sphingomyelin in the plasma membrane of the RBC. It is also called your hot cold glycine because it enhances hemolytic activity on incubation, kaya siya hot, and then subsequent exposure to cold at 4 degrees centigrade. This is exhibited in the CAMP test. It is lethal and thermonecrotic. When we're saying it is, you remember the CAMP test dun atin sa biochemical test wherein you have your Staphylococcus aureus. Inano mo siya, you streak it, and then you have another Streptococcus. Ano si Streptococcus natin na CAMP positive at saka si CAMP negative? So that you will be producing now an enhanced hemolysis giving us the arrowhead hemolysis. Then you have your delta hemolysin, which is less toxic to cells than either alpha or beta hemolysin. This is produced by all Staphylococcus aureus strain that cause RBC injury in culture and produce edematous lesions. And of course, your gamma hemolysin, this is associated with your Panton, Valentin, leukocidin. So I was checking your microbe host activities last night. And one of the question was this, pero may nagsagot lang kasi ng hemolysin. So staphylococcal hemolysin or leukocidin, sabi ko nga kanina sa inyo, will always be your Panton, Valentin, leukocidin. Okay? So, yung mga iba kasi pag hindi in-specify talaga si PVL, hindi ko siya kinonsider. So, you may go back to your lens and then if you have any questions with the activities that I have been able to check yesterday, tignan nyo na lang para kung merong mali na correction, then you can just also call my attention. Okay? So, now, you have your staphylococcal leukocidin, sabi nga natin, and which is our Panton Valentin leukocidin. So, what is it? It is now an exotoxin lethal to our polymorphonuclear leukocytes. So that, what do? They try to form a pore that suppress now again phagocytosis and associated with severe cutaneous infections and necrotizing pneumonia. This is associated with community-acquired staphylococcal infection. So, we're done with our cytolytic toxins. Ano naman yung ating mga enterotoxins? Ano na ulit sabi natin sa mga enterotoxins natin dati? What are enterotoxins? These are our heat-stable exotoxin. Okay. So, they're resistant to hydrolysis by gastric and jejunal enzymes, and they act as neurotoxins that stimulate vomiting through the vagus nerve. So they're also produced by by 30 to 50% of Staphylococcus aureus isolate. So what are the different enterotoxins produced? You have your enterotoxin A, B, and D. These are the ones that are with staphylococcal food poisoning. Then we have our B and C, and sometimes G and I in our toxic skin syndrome. Then you have your enterotoxin B for Staphylococcus pseudomembranous enterocolitis. Now, for the TS the toxic shock syndrome, toxin 1 or your TSST1, or it can also be called, it used to be called your enterotoxin F, pero ngayon tawag na sa kanya ay pyrogenic exotoxin C. This is more associated with, ang ating TSST1 is associated with menstruation-associated TSS. Usually kasi ito na ano nila sa tampon use. So that it is also considered as super antigen because it's, as we know about our super antigen, di ba, ito yung mga nag-stimulate ng ating T-cell proliferation and production of a large amount of cytokines. Kaya may tinatawag sila na cytokine storm. Okay? Now, we also have our exfoliative toxin. Ano naman yung exfoliative toxin natin? Tinatawag din yan na epidermolytic toxin A and B or exfoliating serotypes A and B. So, this is made up of a serine protease that divides the intracellular bridges of the epidermis and causes now excessive sloughing of the epidermis or our stratum granulosum. So, anong disease na kinukos nito? It is the cause of our Staphylococcus scalded skin syndrome, referred to also as the Ritter's disease, and it is also implicated in bullous impetigo. Okay, so what are the different infections that are caused by Staphylococcus aureus? So you have discussed already the different virulence factors of Staphylococcus aureus. Kaya siya ang considered na pinaka-importante, medically important staphylococci. So among those are for cutaneous infections, we have our folliculitis, furuncles, or yung ating boils, or in Tagalog, yung pigsa. Then we have our carbuncles. So when we say folliculitis, we're talking about the hair follicles. So andun si itis niya, so it is a mild inflammation of a hair follicle or oil gland. And the infected area is raised and red kasi nga may inflammation. Now, you have your furuncles or the boils. These are focal suppurative lesions which has resulted from an infection, either din from folliculitis, that extend into subcutaneous tissue. They are large, raised, and superficial abscesses. I know most of you or some of you have already experienced having this, di ba, masakit yan, yan yung may mata, sabi nila. So that when you try to, pag nahinog na daw si boil, yun na yung pinipisa. Yan yung nilalagyan din ng ating mga elders ng para mag-shrink yung inflammation. Nilalagyan nila ng bulaklak ng gumamela. Okay, now you have also your carbuncles. What are your carbuncles? These are larger, more invasive lesions that develop from multiple furuncles which can progress into deeper tissues, present with fever and chills, indicating systemic infection. So, these are the different pictures para ma-imagine nyo naman yung ating skin infections caused by Staphylococcus aureus. So, you have there your superficial folliculitis, and then, sabi natin kanina, raised dome pustule form around hair follicles. Kasi, di ba, sabi natin, infection arising from dito sa mga kung saan, di ba, nakikita nyo yung mga hair follicles. Then, you have your furuncle arises when a large abscess forms around a hair follicle. And the carbuncle, which consists of a multilocular abscess around several hair follicles. Okay? O sino na ang merong experience sa mga ganyan na staphylococcal infection? And what did you do? Antibiotic ba kayo? O hinayaan nyo lang mawala din siya? Or for folliculitis, kung minsan sabi nila pag oily lang ang skin, that pwede din yan, you try to minimize or you try to use cleansers or you just wash the area more often to take out of, para matanggal yung mga oily na secretions sa skin. Okay? So we have also our bullous impetigo. These are larger pustules surrounded by a small zone of erythema. They are highly contagious infection that spread by direct contact, fomites, or auto-inoculation. Then you have the scalded skin syndrome or our SSS. These are localized skin lesions, few blisters, may pemphigus neonatorum, yun sa mga baby. Ritter disease, generalized form is cutaneous erythema and profuse sweat peeling of the epidermis. Kaya tinawag siyang scalded skin syndrome. So you see here now the lesions of impetigo. Ang difference na if you see, di ba alam natin yung sa may herpes simplex virus na ano din, parang ganyan. Pero sa herpes simplex kasi is more of mucocutaneous vesicle siya. Sa impetigo, isolated pustules naman siya that become crusted. So napansin nyo, medyo marami siya dito, usually din sa may lip area. Okay, this is your toxic shock syndrome. So, dyan napapakita yung peeling skin and then yung lesion ng ating scalded skin syndrome. Dito, di ba, sabi natin, nagproproduce siya ng Staphylococcus ng toxin that causes the skin to peel off in sheets. It is especially likely to occur in children under age 2. And the toxic epidermal necrolysis or TEN, which is a clinical manifestation with multiple causes. Now, symptoms are due to hypersensitivity reaction. So, other infections caused by Staphylococcus other than this cutaneous infection, we also have our toxic shock syndrome. But this is rare but potentially fatal. Multi-system disease characterized by sudden onset of fever, chills, vomiting, diarrhea, muscle aches, and rash, which can quickly progress to hypotension and shock. So, another infection that is caused by Staphylococcus due to the production of the enterotoxin is food poisoning. So, sabi nga natin kanina, this is caused by the enterotoxin A, 78% ang food poisoning, enterotoxin D, 38%, and then your B, 10%. So that intoxication resulting from ingestion of a toxin formed outside the body. So that yung food has already been contaminated with Staphylococcus aureus. Okay? And that Staphylococcus aureus now, that contaminated the food, released the toxin. So, habang nandun pa siya, but sometimes hindi natin nakikita na panis na pala. So, pag hindi siya lasang panis at hindi siya itsurang panis, pero nakapag-secrete na si Staphylococcus aureus ng toxin. So, pag nakain na natin yung food na yun, na meron na siyang toxin, then that causes now the food poisoning. So, dito tinitignan kung aureus nga, kung Staphylococcus ang cause, is the appearance of the symptoms. So that yung symptoms niya, pag inaurasan niya, anong kinain mo within this time? Para at least magawan ka agad ng diagnosis na yan ay food poisoning due to Staphylococcus aureus. So that symptoms appear 2 to 8 hours after ingestion. And it can resolve pag naagapan naman, and usually patient are brought immediately. Usually kasi ang food poisoning sa maramihan na sa mga fiesta, basta may maramihang handaan. Okay? Yung mga may maraming tao. So that ang symptoms niya, yan is nausea, vomiting, of course, abdominal pain, may severe cramping, and of course, diarrhea. So, sa food poisoning, pag ang diarrhea there is watery. Parang ano siya. And bakit siya watery? It's already because due to water and electrolyte loss. Sabi nga kanina sa food poisoning, hindi nga mag-a-appear na, hindi natin malalaman na may toxin na pala yung food. So that hindi siya kasi makikita na contaminated na siya. And then even the taste, hindi mo rin malalasahan pa. Di ba may lokohan ko minsan, dali-dali kainin mo na 1 minute na lang, mapapanis na yan. Yung mga parang ganun na lokohan. So that hindi pa napapansin, hindi naman talaga mapapansin na yung food pala ay contaminated with Staphylococcus aureus na nagpo-produce ng toxin. Okay? So that death can occur due to intoxication rather than infection. Remember, if, syempre, pag the food is reheated, it kills the bacteria that has been secreting the toxin. But the toxin, sabi nga dyan, it heats stable. So that kahit i-boil mo pa yan sa 100 degrees centigrade, hindi na yan madi-deactivate yung toxin. Okay? So we have another infection like your enterocolitis, wherein ang toxin naman dyan is your enterotoxin A and leucocidins, the Luc E and the Luc P. Okay, so staphylococcal bacteremia, so we know already bacteremia, so that leads to secondary pneumonia and endocarditis observed among IV drug users. Then another infection is staphylococcal osteomyelitis, because osteomyelitis can be caused by other microorganisms also. So that staphylococcal osteomyelitis is secondary to bacteremia. Then we have staphylococcal pneumonia, secondary to influenza virus infection. We have septic arthritis, which is frequent in children and occur in patients with a history of rheumatoid arthritis or intravenous drug abuse. And you have our acute bacterial endocarditis and also urinary tract infections. So those are the different infections that Staphylococcus aureus can cause. So we just have here, just trying to differentiate the condition, di ba sabi natin kuminsan yung mga age affects also some infections, so that both adults and neonates, including children with septic arthritis, ang causative agent would be Staphylococcus aureus and also Streptococcus agalactiae, Streptococcus pyogenes, and some of our Enterobacteriaceae. Now, sa neonates or children only, makikita ninyo na ang bacteria na nagkukos lang ng septic arthritis or joint infections. Usually kasi dito isang joint lang, so isang part lang. Are Haemophilus influenza type B or our Hib, and also Klebsiella kingiae, and amongst those who are sexually active, so that joint infection or your septic arthritis may be caused already by Neisseria gonorrhea. Okay, so how is the laboratory diagnosis now? So pag-isipin nyo, balik tayo dun sa ating algorithm kanina. So that when we're talking of Staphylococcus aureus, di ba sabi natin may skin infections. So that you can collect the pus. How do we collect the pus? Pwedeng swab, pwedeng aspirate. So you have your purulent fluids, pwede rin sputum, urine, and blood. So first and foremost, lagi when you're doing your laboratory identification is doing your gram stain. So sabi na natin kanina, your general characteristic of your Staphylococcus, they are gram-positive cocci in irregular clusters. Ano yung mga culture media wherein ma-grow natin si Staphylococcus aureus? So you have there now your blood agar plate, you have your phenyl ethyl alcohol agar or our PEA. Ano si PEA? Anong type of agar si PEA? Anyone? Or phenyl ethyl alcohol agar? Ano ang kanyang major component is phenyl ethyl alcohol. Ano ang role ni phenyl ethyl alcohol? Is to inhibit or markedly reduce the growth of gram-negative organisms. Paano niya inhibit ang growth ng gram-negative organisms? It now interferes with DNA synthesis. And you also have here our MSA or your mannitol salt agar. Bakit siya tinawag na mannitol salt agar? Because of the addition of high concentration of salt, making it again selective. Then you have your CNA Ano yung CNA natin? Are Colombian, colistin, nalidixic acid. Then Chapman stone agar and Vogel-Johnson idiom. So, dito natin ipukulture si Staphylococcus aureus. Then take note there that we have one media that that is selective and differential for our MRSA, our MRSA or our methicillin resistant Staphylococcus aureus. So, ang gagamitin natin if we are entertaining also MRSA would be chrome agar. Okay. So, from the culture media, you would be able to come up with the colony characteristic of the microorganism. Parang sinabi natin kanina, anong growth niya sa BAP? Diba? Sabi natin, it can produce, may pigmentation pa siya, may pigmentation siya pag nag-grow siya sa BAP. Meron silang golden yellow color and some, of course, not all Staphylococcus aureus strain produces hemolysis, but if they do, anong type of hemolysis ang naproproduce nila? It is beta hemolysis. Okay? So that, titignan mo din bakit gagamitan siya ngayon ng MSA and PEA. This would be to purify para ang mag-grow lang natin. Since we said that MSA is selective for Staphylococcus aureus, alam na natin kahit pa contaminated ang ating specimen, whatever contaminants that may be present dun sa specimen natin, hindi na siya mag-grow sa MSA. Ganon din sa PEA kasi nga sabi natin yung major component ng ating PEA is phenylethyl alcohol which inhibits the growth of gram-negative organisms. Now, sa biochemical test, we are ang ginagamit yan to differentiate now the different Staphylococcus. Pero sabi naman natin, di ba, when you do it, doon sa unang algorithm natin, you have a gram-positive cocci. Ang unang biochemical test mo would be your catalyst test para di ba, to differentiate your Staphylococcus and your Streptococcus kasi pareho silang gram-positive. So, ang reagent natin, you have your 3% H2O2 sa aerobic catalyst test and you have your 15% H2O2 for anaerobic catalyst test. So, sa coagulase test, okay, no need to further explain this kasi di ba kasama siya sa ating biochemical test. Kaya nga sinabi ko sa inyo, you have had an overview of the different biochemical tests so that what you need to do na lang when we are discussing the pathogens one by one, when you classify them according to their different characteristics. Parang ngayon, sabi natin, catalyst positive, gram-positive organism, Staphylococcus lang. So that nakuha mo na siya, catalyst positive siya. Lahat ng Staphylococcus, catalyst positive. Paano mo na ma-differentiate ang isa sa isa't isa? So that again, you will use now your coagulase test so that you know that your Staphylococcus is coagulase positive. The rest are coagulase negative. So do we say here that your coagulase test is the best single criterion of recognition and pathogenicity of Staphylococcus aureus. Remember, it's one of the enzymes that contributes to the pathogenicity or the virulence of Staph aureus. So again, repeat lang natin, your reagent is rabbit plasma with EDTA. If you remember, bakit sinabi natin hindi pwede ang plasma, ang citrated plasma? Balik na naman kayo sa inyong biochemical test. Bakit hindi pwede ang citrated plasma? Remember that some microorganisms can use citrate as a source of sa inyong SCA because of citrate utilization. Okay? Thank you, Dexter. Thank you, Junior V. Okay. So, alam na natin yung dalawang method. You have your slide method and you have your tube method. So that slide is a rapid screening test. It detects cell-bound coagulase or the clamping factor. So, other slide coagulase positive also could be. It's nice to know. Kasi sabi ko nga kanina, di ba, we're just getting into the medically important Staphylococcus. But of course, hindi naman natin pwedeng hindi alamin kung anong pwedeng alamin sa mga ibang staph species. So that Other slide coagulase positive, sabi natin, if Staph aureus is coagulase positive, Silubdunensis and Schleiferi are also coagulase positive. So why do we get into the tube method? It's just to confirm all negative slide results. Kasi di ba dalawa nga ang coagulase na present kay Staphylococcus. Pwede siyang si bound o si free. So, other tube coagulase positive din, andun lahat, si Hayacus, Intermedius, si Lutre, Delphini, Schleiferi, and again, tignan nyo ha, subspecies coagulans. Kasi dalawang subspecies niya because si Schleiferi na isa na walang subspecies is coagulase positive, but si Schleiferi, subspecies coagulans is tube coagulase positive. Okay, so this has been mentioned already again sa ating biochemical test, sa tube method that you have to incubate for 1 to 4 hours at 35 degrees to 37 degrees, so that if no clot forms after 4 hours, re-incubate at room temperature for additional 24 hours or overnight incubation, so that the results should be read within 4 hours to prevent your false negative reaction. Because fibrinolysin, which lyses the clot form. Diba sabi natin kanina, you have your staphylocoagulase, then you also have your staphylokinase. Na magkaiba ang ano na. Si coagulase is to form the clot, si staphylokinase is to lyse the clot. So that, ang ano kasi dun sa tube is that pwedeng mag-lyse ulit yung formation ng clot. Ang reason nga doon is when the organisms, when Staphylococcus feels na hindi na tama yung environment niya, kailangan na niyang lumabas doon sa clot, then that's the time you have your fibrinolysin now to lyse the clot para makalabas siya ulit doon sa clot na yun. Okay, you have your false positive result for Pseudomonas and Enterococci. You citrate and release calcium-forming clot in the absence of coagulase. Kaya sasabi natin kanina na hindi pwede ang citrated plasma. Okay? Hindi mabilis? Okay lang? So we proceed now to the mannitol fermentation test or your mannite test. So that if you remember in your mannitol fermentation test, di ba sabi natin pag pinag-uusapan ang fermentation, it is in the absence of oxygen. That one. The Staphylococcus aureus now can ferment mannitol and can tolerate high salt concentration. So, anong gagawin natin dito sa mannite test nito or mannitol fermentation test is, of course, our MSA. Bakit tayo may pH indicator? Because we would like to know now ang magsasabi sa atin kung ano ang pH depending on the products of metabolism. So that a positive result here will be yellow-colored colonies surrounded by a yellow halo. Ano yung sabi natin pag phenol red ang ginamit mo at nag-yellow ang iyong colony? Anong pH nun?
Acidic, ma'am.
Acidic pH. So that alam natin na yung end product of fermentation ng mannitol now turned your media acidic. Kaya siya ay nagbigay ngayon ng yellow-colored colonies. Pati yung media mo mag-change din into yellow. Okay? So, another biochemical or their growth again on the different media is their growth on telluride glycine agar. When you get to see now jet black colonies, this is due to the reduction of telluride. Now, other staphylococcus are inhibited, so walang growth. Kung magkaroon man ng growth, hindi siya magbibigay ng jet black colonies. Rather, gray colonies are seen lang. So that if you already have, kunyari, if ano correlate nyo lagi, how you have a gram-positive cocci that is catalase positive, and then coagulase positive pa rin siya, would you still proceed to doing all of the other biochemical tests? Yes or no? Gram positive, catalase positive, coagulase positive. Would you proceed still to doing others like your Manite test, growth on telluride glycine agar, or you have to do again your polymyxin B sensitivity? No, ma'am. Why, Tam? Why no, Tam? Ano ang sabi natin kanina kay coagulase test? When we said, ano sabi natin kay coagulase test kanina? The single identification ba yun? With our coagulase, the best single criterion of recognition and underneath po confirmatory test na
Ma'am, nawala
no,
po.
it's because, at saka for difference na lang
Hello,
yung iba.
ma'am?
It's because, yeah,
Ma'am, nawala po kanina.
yes, no lang.
Paulit na lang. Nawala po kanina, ma'am. Paulit na lang yung
No, wala.
explanation. Hello, ma'am?
Oo, wala akong internet, naka-data ako. Sige, nawala ang internet dito sa school. Anyway, so yun nga kanina 'di ba sabi natin where did we stop dun sa ating mannitol fermentation talking about the coagulase. Kasi kung we go back to the coagulase test, 'di ba sabi natin is the best single criterion of recognition and pathogenicity of Staphylococcus aureus. Even if we say there that meron tayong isa like your Lugdunensis and Schleiferi, but they are not considered to be causative agents of the different infections. Okay? So that if you had already your gram stain, sabi natin gram positive, and then nag-catalase test ka, is catalase positive, and then you had done your coagulase test, and it is coagulase test, and considering that you have had cultured them on different agar, kahit hindi mo na na-culture sa lahat ng telluride and the others, o nag-MSA ka na lang, or even sabi nga natin, it grows well on NA and TSB, and nag-grow ka na sa blood agar plate mo. So that looking at all of those, if you remember, dun sa first part ng ating biochemical, you consider your gram staining reaction, then you consider your colony morphology, and then you have a backup biochemical test wherein you already have your catalase and your coagulase, then you can already have a definitive, hindi na siya presumptive kasi wala naman siyang kasama na pwede mag-coagulase positive. So that pwede mo siyang i-identify as Staphylococcus aureus. So that others, now pag nakikita mo kasi yung mga ibang biochemical na is now differentiating the other species of Staphylococcus. Although with mannite fermentation test or your mannitol fermentation test, again, this is specific for Staphylococcus aureus. Now, yung growth in telluride agar, again, we said there, other Staphylococci naman are inhibited. And if ever na may growth, iba na ang kulay nila. They don't give the jet black colonies, which is characteristic of Staphylococcus aureus. Now, for polymyxin B sensitivity, so that S. aureus is resistant to polymyxin B, whereas other staphylococci are susceptible. So, other tests, you still have here your lysostaphin sensitivity test. Anong ginagawa ng lysostaphin? Kasama pa rin siya dun sa ating biochemical wherein it lyses so that when you see that you have done your lysostaphin sensitivity, diba? And then, what you do here is yung sa, nag-emulsify ka ng colony solution, Yan siya ng lysostaphine disc. So that pag nag-clear yan, ibig sabihin, ano pag ibig sabihin pag nag-clear si Staph aureus? Diba meron kang emulsified bacterial isolate ng Staph or ng question mark muna, Staph aureus. And then ginawan ng lysostaphine. And then sinasabi natin sensitive lysostaphine is 2 microgram ml. So, disc ang ginagamit. Kaya ilalagay dun sa iyong tube na pinaglagyan mo ng iyong bacterial or yung clinical isolate. Pag sinabi natin sensitive, what could happen to your lysostaphine? When we're talking of sinabi natin sensitivity, so that your Staphylococcus aureus sensitive. So, pag chinek mo yung tube after incubation, mag-clear his Staph aureus. Meaning, that lysostaphine was able to remove all of may telephone number. Sensitive Staphylococcus aureus. So, ano mangyari doon sa ating when we're talking of antimicrobial susceptibility testing and we say that this is sensitive to, like Staphylococcus aureus is sensitive to lysostaphine. Mo, diba, nag-emulsify ka or nagay ka ng bacteria isolate mo dun sa na may phosphate buffer. Nag-grow si aureus, pero nung nilagyan mo na lysostaphine, hindi siya makag-grow. Okay? Sa micrococci, resistant siya, grow lang siya kasi wala sa pakialam kay lysostaphine. Now, you can also do your VP test. We natin earlier that was VP test more test for the differentiation of our enterobat. Pero pwede rin sa Staphylococcus, wherein now your VP test would differentiate Staphylococcus aureus, which is from the negative Staphylococcus intermedius. So you have your culture medium, it's actually your MRVP kasi hindi naman napaghihiwalayan usually. Ang kakaiba lang nila with your MR, pag MRVP is you, tapos mong hahatiin, it is just the reagent that is different for both tests. So that ang reagent mo sa VP is after growing your isolates, then you add your alpha-nitol followed by your potassium hydroxide. So other VP positive, meron kayong lugdunensis, hemolyticus, yan yung ngayon babalikan yung mga biochemical test. So, another again, your DNA methyl green agar. Review ano ang positive ng DNA methyl agar. Methyl agar. Wait lang. Check natin baka may internet. Baka hindi kaya ng aking aking data. Aha. So what happens, ano yung mangyayari sa ating deoxyribonuclease test or adenase test? Then ang ating culture media, di ba, we have our DNA methyl green agar. Ano yung isang indicator natin dito? Di ba pwede tayong gumamit din ng toluidine blue. But when we're using your DNA methyl green agar, ano ang denase positive? Review ng inyong biochemical. Para bukas sa quiz ninyo, alam nyo na. Ano ang positive ng denase test? When we say denase positive, using your methyl green agar. Okay, thank you, Junovic. Clearing around the colony. Okay, so those are the different biochemical tests that you can do for Staphylococcus aureus so that you have your mannitol salt. Start tayo from your catalase to coagulase, and then you have mannitol or the mannite fermentation test. It's growth on tellurite, glycine, agar. You have your polymyxin B sensitivity, then your lysostaphin sensitivity, your VP test, and your denase test. So, ito yung mga itsura nila lang sa mga just to familiarize you with the different growth of your Staphylococcus on the different media. Sabi niya jet black pero not well appreciated naman yung jet black. Siyempre picture na lang yan. And then you have also, may PYR pa pala siya. So we also have our pyrrolidonyl arylamidase test or the PYR. Differentiates again your coagulase positive staphylococci by slide method. Now, if we're talking again of our coagulase positive staphylococci, so isa lang naman ang coagulase staphylococci natin. Siyempre, not disregarding lugdunensis. Kasi kung coagulase positive, then it is our Staphylococcus aureus. So again, you have there the substrate and the reagent, and of course, the end product wherein the result would be cherry red. So, ang negative lang dyan would be your Staphylococcus aureus, and the rest of your Staphylococcus are PYR positive. Okay? Then, you have rapid methods of identification. When we're talking of rapid methods, these are more of the automated or they're already commercially available. So that we can do particle agglutination tests. We have different brands of available for this test. You have the Staphylocide, the Staph-Aurex. Kasi depende na yan sa kung anong company ang nagmamanufacture. So when we're talking of particle agglutination test, you have here your plasma-coated Courier particles or what we call the latex. So yung plasma detects both clumping factor and also the protein A in the cell wall of Staphylococcus aureus. Now, we have molecular methods. Of course, pag molecular methods na ang pinag-uusapan natin, then we have our PCR. But ano ang use ni PCR? This is more into identifying our methicillin-resistant Staphylococcus and also our MSSA. So that, ano ang hinahanap natin when you're doing your real PCR? It is the identification of the MECA gene, which is what we look for pag nag-entertain tayo ng methicillin-resistant Staphylococcus aureus. Specimen would be anterior near swab. And of course, as always, ang advantage ng mga molecular methods would be rapid detection test for MRSA. So another of the medically important Staphylococcus is our Staphylococcus epidermidis. So alam natin that your epidermidis is what? Di ba kasama naman ito sa ating indigenous microbiota of the skin. So that ang ng Staphylococcus epidermidis, if you remember the general characteristic and ating algorithm earlier, so who can give me identifying characteristics of Staphylococcus epidermidis? Ay, nakalagay. Sige. Identifying characteristics. Start from gram staining. And then you get into the colony characteristic. Anyone? Tingnan ko walang nag-aano ng inyong chat box. Okay. Identifying characteristics you have. Again, of course, they're gram positive. Okay, Tam. Tapos, colony characteristic. Okay, Israel is gram positive, catalase positive, coagulase negative. Then, so you can see them all also from the laboratory diagnosis. So that we see, pag samasamahin natin yung sinabi nyo, but when we say Staphylococcus epidermidis, gram-positive cocci and cluster, they have white, creamy, raised growth on blood agar plates. Kasi sabi nga natin kanina, sa general characteristic, we can grow them on blood agar plates. They are non-hemolytic. Meron siyang, tignan mo yung positive growth sa CNA. Okay? And then negative DNase, negative mannitol fermentation. Ngayon, to be differentiate it with your coagulase negative stuff na si saprophyticus, this is where you do already your susceptibility test with novobiocin. And epidermidis is susceptible to novobiocin. Okay, so makita natin dyan that we say here that it is a contaminant of medical instruments, catheters, the CSF shunts, and prosthetic heart valve implants, and also with hip prosthesis. Nag-grow sila dyan. Bakit sila nag-grow dyan? Ano ba ang kanilang virulence factor? Okay, to take note that ang virulence factor ni epidermidis is their ability to form biofilms. If you remember doon, prior sa ating mga lectures about these biofilms, what do? They produce this, they have the ability to form these biofilms through the production of cell surface and extracellular compounds that promote the bacteria to adhere to plastic surfaces of prosthetic devices. Ano yung nag-help sa kanila mag-adhere? Is already your ano na ulit ito, gamma-DL glutamic acid or the PGA. Ito ang tumutulong kay epidermidis para kumapit dyan sa mga devices like medical instrument, catheters, sa mga prosthesis, and others. Okay? So that other Staphylococcus is also our saprophyticus. So, sino naman si saprophyticus? So, again, is another microorganism that belongs to the or is present on the normal flora, again, indigenous flora or the microbiota, and in the periurethral and urethral flora. Yeah, it adheres effectively to the epithelial cells lining the urogenital tract. So that lagi nito is itong sexually para lang ano tawag doon, pag nakikita yung sexual entertaining saprophyticus to be the causative agent of UTI, lagi nakadutong yan, common cause of UTI in young sexually active men. So that it is also the cause of associated UTI in men and women. So, ano ang virulent factor naman ni Staphylococcus saprophyticus? So, ang kanyang virulence factor is its ability to adhere to epithelial cells, sabi nga natin dito, and in the urinary tract, urethral cells. So laboratory diagnosis, again, you have there growth on blood agar plates, white, opaque, slightly larger than pinheads, non-hemolytic colonies, although some strains produce yellow pigment. Biochemical test niya, you have your coagulase negative, SDNase negative, and mannitol negative. It is resistant to novobiocin, sorry, hindi ko na correct novobiocin, and nalidixic acid, and also the absence of phosphatase production. So just, it's nice to know, ito yung sa ating novobiocin susceptibility test, which reminds me again that please go back to your streaking technique kasi doon sa inyong midterms, doon sa last part, yung part 5, parang mali lahat ang mga streaking technique na sinulat ninyo. Okay? So that even when you try to get into the laboratory module, kasi nandun naman kung paano yung streaking technique, para at least ma-refresh lang kayo kung ano ba yung mga iba-ibang streaking techniques, especially when sa ating plated media tayo nag-i-inoculate or nag-grow ng microorganism. So this is your novobiocin susceptibility test, wherein you see that your saprophyticus is resistant. Okay? And of course, it's nice to know we get into lugdunensis, which is, we said clamping factor positive, but tube coagulase negative. It contains the MEC-A gene that encodes oxacillin resistance, is more aggressive than other coagulase negative staphylococcus in infectivity. So what are the different diseases that lugdunensis can also cause? It can cause infective endocarditis, septicemia, meningitis, skin and soft tissue infections, also in urinary tract infections, and septic shock. So, other coagulase negative staphylococcus, kasi if you remember, sabi ko kanina, di ba, ang ating coagulase positive staphylococcus aureus lang. And then you have your coagulase negative staphylococcus wherein we're considering epidermidis and saprophyticus. But to join, of course, your saprophyticus and epidermidis, meron pa tayong Staphylococcus warneri, Staphylococcus capitis, simulans, hominis, and schleiferi. Now, hemolyticus is found in wounds in bacteremia, endocarditis, and urinary tract infections. And colonies are medium-sized with moderate or weak hemolysis and variable pigment production. So, since the catalyst negative would be your streptococcus. Okay? So that pag positive siya, it would be your Staphylococcus aureus. If negative, now you'll have to do your oxidase bacitracin susceptibility. Positive or susceptible, you have your Micrococcus species. Negative or resistance, you have there now your coagulase negative Staphylococcus species. And we're talking of the Staphylococcus species, you proceed with the novobiocin susceptibility. Ginagawa ang Micrococcus. Why? Hindi natin inaano ang Micrococcus. Ano ba ang pinapose ng Micrococcus? They're not really causative agents of human infections rather, ano mga kinakos nila na ano, they are rarely involved in infection. And ang micrococcus natin, they are considered contaminants of clinical specimens. Okay, so parang doon sa unang algorithm kanina, pag coagulase negative, then we proceed into doing our novobiasin susceptibility para makita natin kung sino ang sensitive at sino ang resistant. So that another of your katuloy ng ating algorithm, pag nag-oxidase positive, bacitracin susceptible, so you do the different test again, and then yung PYR. Then you have your tube coagulase and then alkaline phosphatase. But this is nice to know para makita nyo lang kung paano bang gagawin mo if you do your oxidase or your microdase test and the bacitracin susceptibility test. Okay? So, otherwise, not that I don't want you to get into this, but para lang makita din ninyo. But of course, what is more important would be kasi pag nakita niyo, bumaba kayo, andun pa si VP test niya, which was already presented earlier. Kung paano lang dumating at kung bakit kailangan ng VP test and the other biochemical test for Staphylococcus. Okay? So, we get into the resistant genes. Di ba? Kaya nga tayo may MRSA. So, we have these resistant genes produced by Staphylococcus. So we have the erythromycin ribosomal methylase or the ERM gene. This is a class of enzyme inactivating genes and cause for the methylation of the 23S ribosomal RNA. This results in resistance to erythromycin. Okay? It may not be detected in routine susceptibility testing. That's why, pag ang pinag-uusapan na natin is the susceptibility of Staphylococcus aureus or your MRSA, this can usually be done through our molecular techniques, which is our PCR. Now, another resistant gene is your MSRA gene or the methionine sulfoxide reductase, which codes for efflux mechanism. The resistance to erythromycin but susceptibility to clindamycin. Now, let's talk about the methicillin-resistant Staphylococcus aureus. It is a type of Staphylococcus aureus that is resistant to methicillin, nafcillin, and oxacillin. Now, it is acquired after prolonged stay in the hospital, close contact with carriers. Now, ano yung mga carriers ng MRSA? Anong tawag natin sa kanila if you were going to classify your carriers? Which reminds me again, doon sa inyong types of infection, doon sa inyong activity, di ba may iba-iba kayong types of infection? Meron kayong type of infection according to source, according to occurrence. So the some of you have, ang saya-saya nila sa loob, ano kayang meron doon. Anyway, some of you have answered kasi dapat doon ang sagot yung iatrogenic, may mga ibang sinagot. So you just go over para at least alam nyo ha, hindi porket ano, tignan nyo din kung ano yung mga, nawala na naman ako. Tam? Okay. Kasi nakita ko may message si Tam. Ma'am, nawala ka po. Okay. Kasi kung minsan hindi ko alam, nagluluko internet dito sa office. Okay? So, methicillin Staphylococcus aureus, sabi dito, is acquired after prolonged stay in the hospital, close contact with carriers. So, natanong ko kung if you are a carrier of MRSA, anong type of carrier ka? Diba, meron tayong iba-ibang types of carrier. Anong type of carrier ka? Kalimutan nyo na yun sa microbe-host interaction ninyo, yung types of carrier. Meron ka dong causal, it's not casual ha, causal. Then you have your, ano na yung types of carrier ninyo. In nosocomial is different. When we talk of nosocomial, is more of the type of infection that is brought about by hospital environment. So, hindi siya yung carrier na pati ako nakalimutan ko na tuloy. Balikan na lang natin pare-pareho mamaya. Okay? Kasi kung MRSA, asymptomatic ito, you're not showing any symptoms, but you have it with you. Usually contact yan. Kasi saan ang MRSA? Sa nails, sa hair, sa ganyan. Hindi natin alam. Okay? So that the treatment of choice for MRSA is vancomycin. Ayun ang gagamitin pag mag-susceptibility testing, just to check also for MRSA. Now, the different types of MRSA, you have community-associated MRSA, you have healthcare-associated community onset or the HACO, MRSA, and hospital-associated MRSA or your HA MRSA. Ano yung gene na nag-encode ng penicillin binding protein, the altered penicillin binding protein, that is your MEC-A. Okay? So that laboratory diagnosis, if you remember the different screening tests that were presented sa ating antimicrobial susceptibility testing, wherein you have the oxacillin screen test, you have the chromogenic and the rest. So that oxacillin salt agar plate, this is used to screen for MRSA in clinical samples. It differentiates MRSA from hyperproducers of beta-lactamase or the borderline oxacillin resistant Staphylococcus aureus or your Borsa. Now, ano pa ang gagawin natin? The chromogenic test. This is more for, again, for MRSA. So, ang ginagamit ay, with the chrome agar, you have the chromogenic selective differential media. And the cefoxitin here inhibits now non-MRSA. So there will be changes in color of MRSA colonies within 24 to 48 hours using chrome agar against colonies of non-MRSA. So this is your chrome agar. Pag MRSA ang present doon sa ating specimen, then ang ating colonies would be mauve-colored. Pink to mauve pink to mauve colored colonies ang maproproduce sa chrome agar. Okay? So we can also do latex agglutination like detect altered, again, your penicillin binding proteins. It's an alternative method for testing and confirmation of oxacillin resistant, and this can be performed on both coagulase negative Staphylococcus and Staphylococcus aureus. So you see here that the gold standard for MRSA detection, remember we're checking for the gene MEC-A, which encodes for the MRSA. Diba? So that ang ginagamit, the gold standard for MRSA detection would be your molecular nucleic acid probes or PCR amplification. So for the vancomycin resistance Staphylococci, screening would be using the vancomycin agar plate. Then we have our macrolide resistance, which is modified double disc diffusion test or the D-zone test. Again, this was presented doon sa ating antimicrobial susceptibility testing, wherein you have a blunting here of the this with clindamycin. Okay? So, merong blunting dito sa may clindamycin disc. So, the 15 microgram erythromycin disc and 2 microgram of clindamycin placed 15 millimeters to 26 millimeters apart on MHA and back. So, that is your D test or the D-zone test, checking for macrolide resistance. Then the beta-lactamase test, you have your cephalosporinase test, you have your acidometric method, we have the iodometric method. For the cephalosporinase test, it uses cephalosporin or the cephinase disc. Of course, the substrate is nitrosaphine, and the positive result would be deep pink or red color within 10 minutes. For the acidometric method, the reagent here is cyclid buffered penicillin. pH indicator again is phenol red. So that positive result would be, again, you'll get your yellow color. There is a decrease in pH. And the iodometric method, reagent here is citrate buffered penicillin and starch iodine complex. Positive result would be colorless solution. Penicilloic acid reduces iodine and prevents it to combine with starch. Negative result is purple. And for the antimicrobial testing, for treatment is methicillin, oxacillin, nafcillin. Sabi kasi natin ito yung mga dapat, pero this should be those that are penicillinase resistant penicillin drugs. Most commonly used is oxacillin. For cutaneous infections, we use oral oxacillin or dicloxacillin if allergic. Erythromycin may be substituted. Pag systemic na ang infection, then we can use parenteral nafcillin or oxacillin if allergy again. Vancomycin or cephalosporin may be used. For MRSA, vancomycin alone or in combination with rifampicin. So those are for the treatments. And we have here again the screening test. Na-discuss na rin ito noon. Screening test for MRSA, which is the oxacillin screen plate. So this is more of a screening test now for MRSA. Culture media, MHA with 4% sodium chloride and your 6 microgram per ml oxacillin. Then you have the microdilution testing wherein oxacillin and cation supplemented MH broth containing 2% sodium chloride. The resistant, there will be growth of more than 1 colony. Susceptible, there will be no growth on agar plate. For the coagulase negative Staphylococcus, resistant will be 24 millimeter zone of inhibition. Susceptible, greater than 25 millimeter zone of inhibition. Although it has this disadvantage that it does not reliably detect oxacillin resistant coagulase negative Staphylococcus. Then the cephositin disc diffusion. This is the preferred method for detection of oxacillin resistance for both Staphylococcus aureus and Staphylococcus lugdunensis. So the interpretation, again, of course, is this diffusion. So resistant is less than or equal to 21 millimeters. Susceptible, greater than or equal to 22 millimeters. Then the macro E test, detection of the heteroresistant visa vancomycin intermediate Staphylococcus aureus because the test uses a higher concentration of organism. And also you have the vancomycin agar screen plate. So Staphylococcus aureus should be screened with 6 microgram per ml vancomycin incorporated into the brain-heart infusion agar. The best method for detection of either vancomycin-resistant S. aureus or the vancomycin intermediate Staphylococcus aureus, so that any growth or colony will be seen when we're doing the vancomycin agar screen plate. The confirmatory test for oxacillin resistance, the broth dilution, and the E-test. And, okay, so those are the different screening. So, balik tayo dito sa ating screening test for the methicillin-resistant Staphylococcus aureus or the different resistant genes that Staphylococcus aureus can have. Okay? So, any question? Saan yung last na slide natin? With the